Welcome back to Morning Break and this month's Brain Matters segment brought to you by Gates Brain Health, where we have Dr. Randall Gates, who is a board-certified chiropractic neurologist and chiropractic physician, joining us. And this time we're not really talking about the brain, we are talking about the prostate cancer. And it is a very, very common form of cancer, and one of the most severe, or sometimes it can be very deadly for men, right?
Absolutely. So cancer is the #2 cause of death, and prostate cancer in men is the second most common cause of cancer deaths.
Wow.
So it's a big deal. 1 in 8 men are said to have prostate cancer, but when you look at the condition, it mainly affects older men. So men over the age of 50, I believe, around 60, no, excuse me, men over the age of 65, 60% have prostate cancer.
Oh, wow.
So though prostate cancer is not my area, with Advanced Imaging Reno, wanted to talk to you about prostate cancer detection with MRI.
Yeah, and so is MRIs for prostate cancer a common thing to use?
It was not.
Okay.
But it's gaining traction in the literature.
Okay.
So if I could paint the picture, let's say medicine has gone back and forth, healthcare has gone back and forth on using the PSA test for prostate cancer detection, which is a blood test. Very simple, very cheap, very easy. However, the American Academy of Family Physicians argues that this leads to unnecessary investigations, unnecessary biopsies, treatments, etc. The American Neurological Association says just the opposite. They say we need to be checking men at around the age of 40.
Wow.
Particularly if there's a prostate cancer history, whereas the American Academy of Family Physicians says that we shouldn't be doing PSA as a goal, as like a standard measure, only doing it if the doctor thinks the patient needs that to be done.
So then the MRI comes in for what kind of patient?
Well, particularly now, the MRI can give both sides more data. And that's the beauty of it. And so MRI with AI, so AI tools can actually quantify lesions within the prostate. So now we can take not just one measure, but many tests and put them all together. So we can say, what is your PSA value? What is it now? What is it in a year? Is it going up? That's called the PSA velocity. We can look at PSA and PSA free. We can also now, when we do something like an MRI, we can create a prostate density. So you take the PSA value, divide it by the volume of the prostate from something like an MRI, ultrasound can do it too, and now you get a measure there, because maybe somebody has benign prostatic hypertrophy. And then with the AI tools within MRI, we can actually say, oh, there is a lesion, and this does not look good. There's a whole rating scale for lesions within the prostate. So as part of our whole body MRIs, now we're starting to do this AI quantification of prostate issues.
Interesting. And so the type of client that might benefit from this, is it somebody who is concerned, maybe they have a family history, but the doctor isn't recommending the PSA yet? Or is it something that, you know, still get the approval of your doctor, then go to Advanced Imaging Reno and get this done kind of on extra?
Yeah, I think definitely these are all conversations for patients to have with their doctors, and now these tools are available here in Reno, which is really, really exciting. And wherever your doctors may lie, and patients may have a family doctor who's not into checking PSA anymore, and they may have a urologist who is into it. And because 60% of men over the age of 65 have prostate cancer, this is a really, really valuable tool.
Yeah, and is prostate cancer something that we're seeing becoming more frequently diagnosed too?
Well, yeah, the rates are going up considerably. We're living longer, and this is another huge argument. We just had somebody who was quite notable in our society where they stopped checking PSA values, and then as a result, it led to a severe case. And the argument is that not checking PSA after the age of 70 or 72 is based on actuarial data, which is data from like insurance companies, saying, well, you're only going to live about 10 or 11 years, so why check your PSA anymore?
Right,
interesting. Versus if that's that individual's father, brother, you know, dad, wouldn't you want it checked? And wouldn't you want them to have the best? And that's where now Advanced Imaging Reno can pair with people's GPs, urologists, and really add benefit.
Absolutely, and we always think too that one, cancer doesn't have to be a death sentence and stuff, especially with early detection. And so those are two big things that you're really emphasizing.
Absolutely, and that's where whole body MRI is so valuable.
Absolutely. Well, I will make sure that all of the information about whole body MRIs through Advanced Imaging Reno, and of course, Dr. Gates's clinic, is that the right word for you? Gates Brain Health will be on our website, kolotv.com after this show, so that if you guys have any further questions that you want to look at, you definitely can do so on our website. Dr. Gates, thank you so much for being here.
Thanks
what
so
an
much for
interesting
having me.
topic. I really appreciate it.
Yeah, absolutely.
Thank you guys for watching. We'll be right back.